Hi, this is Dr. Fab Mancini, and I'm so excited that you've joined us because today's show, I'm going to have something very special for you. There is a technology that I've come aware of, and it's called AVACEN. And this technology, what I love about it is that it's simple, easy to implement in your household, or if you're a provider like me, in your practice. And it's basically founded in the science of microcirculation. And in order to learn more about it, I've invited the co-founder, Danielle Forsgren. It's so good to see you.
Thank you. I'm so thrilled to be here.
Well, I still remember when we first met and I saw that we were at this anti-aging event and you had a long line of people wanting to put their hand in this machine and just experience it. And then I saw that after 15 minutes or so, they were walking out of there with a big smile. So tell me a little bit about the early beginnings of AVACEN and what made you and your husband, Tom, create such an incredible device that is revolutionizing healthcare.
Well, thank you, Dr. Fab. 15-year journey, and we continue. So this device was actually invented for my older sister who had 25 years of chronic migraines. That means like 20 to 25 a month. So she was really suffering. She was on so many medications that were making her even worse. She lived in a dark room, not eating. And my husband was working on thermotherapy. And I was looking for anything. And she was very Western medicine, which is awesome, but very Western medicine in their thought. So everything I would bring to her, they'd go, nope, have a pill. So very frustrating when I knew that there was something out there other than that, because those weren't helping at all. So Tom came up with this aha moment, and that's kind of the brilliance of Tom Muehlbauer. He comes up with these things either in the middle of the night or while he's washing his hair in the shower, right? When everyone gets their great ideas. And he said, I'm going to get this done for the world of migraine sufferers, and especially for my sister-in-law. So fast forward, we get a prototype, we take it to her. In 7 minutes, she goes from ashen gray to light pink, and we're like, aha, we've done something. We have no idea what it is. So then we did 6 years of research and development. We got our FDA Class 2 clearance, and that was just the beginning. So we've had over 22 million treatments with not one adverse effect reported, which is huge, because it's basically a dry heat pad, a vacuum, and your own body's natural adaptations.
What I love about this technology is how simple it is. As a healthcare provider, one of my biggest challenges is that the consumer is really frustrated in the fact that traditional medicine is very limited in a lot of times in helping somebody relieve or put their condition, their healthcare problem in remission. What they do very well is manage the symptoms of that condition. Well, you and Tom are going above and beyond, and it's commendable to me because neither one of you are doctors like me,
No,
where
I'm not.
you think somebody would have taught you this information and you would have been trained in the health of the human body. But some of the greatest technologies that are coming about have come from people like you that are really dealing with someone in your family struggling, but you don't choose to give up. You don't allow that condition to become a sentence, a life sentence for the rest of your life. You had a sister that was struggling, like many people that are watching us right now. Headaches and migraines are something that is so common today. But there are all kinds of pains out there, back pain and neck pain and body pains and joint pains, and people that are struggling with no answer. We also have the opioid epidemic in the United States. We have a big problem by which we know that the consumption of opioids in the United States, which are the painkillers, is over 85% of the whole world. And even though we make a very small portion of the world, population-wise, size-wise, we're consuming over 85% of the opioids in the world. So what I love about this is, and you mentioned many of the things, is the fact that the FDA cleared it primarily for pain management naturally, yes. And you're doing it primarily through microcirculation. So tell me a little bit about some of the cases, or maybe a couple of cases that you can think of individuals that were struggling with chronic pain, and how is it that AVACEN was able to help them?
We have pages and pages. We have hundreds. In fact, one day I would love to compile a book just on AVACEN story.
You know, what I love about those stories is we know that a lot of people they get frustrated because there's no solutions. And we know that over-the-counter painkillers also are very irritant, especially to the digestive system, the lining of the stomach, and the toxicity of the liver, even the kidneys.
Actually, we open up the vascular system, push the blood where it needs to go, which makes it a great delivery system. So you're getting better microcirculation. Just not circulation. You have to do a lot of working out for really, really great microcirculation, but this is just the extra push that so many people need.
Well, you mentioned at the beginning of the show, the holy grail of anti-aging. I am seeing more and more people spending more money on cosmetics, face creams, etc. As you know, plastic surgery has risen tremendously over the last 35 years. Tell me a little bit about how microcirculation actually allows our skin and our bodies to look younger than ever.
Yes, well, the reason I do this device for up to 2 hours a day, sometimes more, is because we are allowing your body again to create more collagen. There's no pain, there's no bruising, there's no injections, and there is no cutting. So great microcirculation is just an amazing tool to live forever. I mean, I want to live as long as I can, but I don't want to be sitting in a wheelchair.
Yeah, but you also have had many plastic surgeons using this device for their patients.
That is true.
After the surgery, because it increases the time by which they can be able to reduce the bruising and also the inflammation caused by the surgery.
That's right. And also getting off the pain meds. I think that's half of the battle when you're healing and then you're having to take these pain meds that make you feel worse most of the time. So no bruising and no swelling. So you could go back to work in like a week instead of 3 weeks.
Now, you also have a lot of providers like me. I'm a doctor of chiropractic, but you have medical doctors, osteopaths, naturopaths love you, acupuncturists using this device in their practice for their patients. So tell me a little bit what made you recognize the value in inviting providers, because the credibility of this unit is not only by the consumer and the fact that you all have the clinical studies to support it, but also the fact that so many providers are using AVACEN in their practices. What does that do for you and Tom when you're thinking all of these hundreds of providers out there
crazy.
That are helping thousands and thousands of people?
It's crazy. It's really, I think it's humbling when we have so many people, not just in their homes, but so many people that are professionals. I took it to my chiropractor and said, hey, check this out. I wasn't seeing him every 2 weeks or every week. I was getting better. And he's like, okay, what are you doing? I'm not seeing you. And he loves it when he doesn't have to see me. We just kind of chat at my treatments now. I took it there and I said, I'm leaving this with you. I want you to tell me what you think. And he was working with the Navy SEALs in San Diego, and he was working with some NASA astronauts. So he was finding all sorts of incredible things. So I would come in for my adjustment, and I'd see his 2 patients on tables with the AVACEN laying down. All of his patients use this either during his treatment or before they see him. And then we heard from naturopaths. The last 3 years have been very difficult on practitioners, also on the public. Their patients couldn't see them. So we were delivering these all over the world because this is like having a doctor in your home. When you can't get to your doctor, stick your hand in the AVACEN. Your body really wants to heal itself, right?
Well, and recently, one of the things that I'm most excited about is the fact that we're seeing tremendous benefits by people that are using AVACEN when it comes to their emotional stress and their mental health. So let's talk a little bit about that, because we know that the world is still recovering from the pandemic, the disruption that it caused. Statistics by the CDC in the United States are showing that the number of depression, suicides, anxieties has risen to levels that we've never seen before. So microcirculation allows the body to respond to stress much better. But how do you see the benefits of AVACEN when it comes to the stress of individuals out there?
Yeah, well, thank you. Even with our young ones, by not being able to go to school, look what it did to them. It was very, very debilitating. Through my chiropractor, again, he was working with the Navy SEALs, and these guys are tough. but they're also, when they finish, they're very broken, and they're physically and mentally broken. They've seen a lot of horrific things. He was handing them a device to take home and use. They were sleeping better. They were not having nightmares. I was just talking to one of our affiliates, and they said they loaned a device for 2 weeks to a gentleman who had terrible PTS. And guess what happened? He called up and said, come pick up the device. I'm fine. I'm sleeping. I'm not having nightmares. I'm doing really well. Because along our journey, we found out that we engaged the parasympathetic, right? So that is the opposite of fight or flight. That is rest and restore. So when you put your hand in there, we are basically giving you a massage from the inside out. So we're just relaxing your whole body. And so sometimes when people use our device for the first time, they fall asleep with their hand in the machine, and they'll be at an event and they're like passed out. And I kind of take a little picture sometimes because I've got all these great pictures of people it's kind of like you put your hand in the device, you do a treatment, and your body just takes a big breath and relaxes.
Yeah. And that's what you call the restore, because right now our bodies are dealing with so much. But I want to say thank you personally for you and Tom bringing this amazing device to the world. It's made a big difference to not only Karen and I, but our families. And even including our aging parents,
yes.
Which many of them can't get to the gym. And now, because we all have home devices, we can actually just put our hands there and be able to allow them to restore and rejuvenate and repair many of the damages that have been caused over time. So, and for those of you that are listening, I just want to tell you that I'm going to put the link right here, but please click on this link and get more information about AVACEN, because I really believe that it could be the answer of whatever you're looking for. And if you're a provider like me, look, there is no reason why you can't have this as one of your components to be able to help all your patients. I know not only in chiropractic, we have many chiropractors using it, but I know medical doctors, naturopaths, acupuncturists, and many others that are actually using it for their patients so they can recover much faster. And you know who benefits? You and them. And that's what's important. We're here to help people get well, and we're here to promote health and wellness in a natural, holistic way. I have found that the FDA was very good at giving the classification and the ability for AVACEN to be out there, especially not only for chronic pain, but pretty much for any condition that can benefit from microcirculation and the improvement of it. And that's pretty much every condition that I know as a provider. So thank you so much for tuning in, and I look forward to seeing you next time.